Okay, we're getting ready to get started for a special meeting for the Henry County Council. We're going to start with the pledge led by Bobby and then a prayer, following by a prayer. Everyone, please stand. Almighty God, we thank you for this time that we can gather in this great country. We ask that you be with this body and you keep this county in your hearts. In your precious name we pray. Amen. Okay, we just have one item on the agenda for this meeting, then we'll have additional meeting following. So this meeting is to address a resolution that was passed earlier this year. So we are going to look at rescinding a decision that we made because of something we need to take care of for the state. So we are looking at resolution 2025-0519-003, a resolution rescinding the prior allocation of the revenue to the volunteer fire departments and the Newcastle Fire Department for the year of 2026. Shannon, would you like to give any detail following up on this since you've led this?
I'm looking for the actual ordinance. One of the other council members asked for it. I thought it was in Joel's email, but it's not. The ordinance was the ordinance that we passed in February that would have modified, amended the misinterpretation of the ordinance from last July by the DLGF. The DLGF reached out and said they will not recertify based on the numbers that we sent in February. They said that amendment had to have been passed before December 31st. And we had to continue with things the way they were, although they did admit that they made a mistake with 911. The percentage that was allocated for 911 in the certification from DLGF was a little over 0.09, I think, and we needed to, the tax council passed 0.1, or the county council did, so they fixed that, which will change some things. Then they quickly told me that the February ordinance, which was an amendment to last year, will be looked at by the State Board of Revenue, or the Department of Revenue, and the State Budget Agency as definition for 2026, and we do not want that to be considered for 2026. Therefore, they said it would be in our best interest to rescind that ordinance as soon as possible, and I'm looking for the ordinance.
So in rescinding that ordinance, that does not, I just want to clarify, that does not take away any funding that was approved for the fire departments. There was some confusion in the email that you sent about rescinding ordinances. I received a few phone calls for fear that they would not get any funding.
You're absolutely correct. It does not change anything that was passed in July of last year for 2025 funding. Nothing. So rescinding this ordinance, they have assumed that it is applying for 2026, and that is not what we want to do. So we need to rescind that ordinance so we can have another tax council meeting in July to consider what the fire departments would like to apply for 2026.
What was that ordinance number again, Shannon? Yes.
2025-0203-001.
Are you looking for a motion to rescind that? Pardon? Okay. Go for it.
Okay, first, to the gentleman in the very back, you're more than welcome to stay, but that sign violates our rules of decorum, so you'll have to remove that. We have rules of decorum that we must keep, so I'll ask. Mr. Harvey, can you weigh in on that, please?
I think let's just go forward with the hearing.
Okay. All right, so we're here to hold a hearing to address resolution 2025-0519-003, a resolution rescinding the prior allocation of the revenue to the volunteer fire departments and Newcastle Fire Department for the year of 2026. As was stated, this is the reasoning for this resolution. Is there any further discussion or motions on this hearing from the council body? Okay, hearing none. Are there any to speak from the public at large? I'll ask again, are there any that would like to speak from the public at large? Hearing none, I will entertain a motion from this body.
I do have one question, and it's more informational for me. Because everything has moved at a snail's pace, but quickly as well. Could we get copies of what the current funding levels will be for 2025?
Yes, I can send what those on.
Thank you.
You still want me to print this, or do you want me to just email it to you? Okay, thank you. I found the ordinance and emailing it to the entire council.
Okay, can you add Debbie to that and please make sure it's in,
I have the old one I have.
okay, and just make sure those are in the minutes for this, please. All right. Do I have any motions on this resolution?
I'll make a motion to rescind the previous, I'm looking for the number, resolution 2025-02-03-001.
I'll second. Okay, we have a motion and a second. Is there any further discussion? All those in favor signify by saying aye.
Aye.
All opposed, same sign. Motion carries 6-0. Okay, thank you very much. So do I have a motion to
Adjourn the hearing.
adjourn the hearing?
So moved.
Second.
Second, okay. All those in favor signify by saying aye.
Aye.
Opposed, same sign. All right. Well, this hearing is officially adjourned. Thank you, everybody. We'll take it just like a 5 minutes and then we'll start in the health. Did we have a specific time on that, Debbie? Or is it just following? Okay, so give us just a couple minutes and we'll start right in the health department.
I could probably modify that to rescind the other one from 2020. What I'll do is
Okay, and then I'll have to put this at the next meeting.
or they can just sign it. I mean, since they've essentially in essence approved it.
Okay,
So,
so he's putting the amendment that they,
yeah, it'll basically just
Rescinded.
3.
okay, so you'll just
Yep.
send me a new copy of that
Yep.
then? Okay,
I'll just get rid of that
okay,
and that,
okay,
and then we'll do that.
okay,
All right.
thank you.
Okay, Angela, are you ready? Steve is on his way, so he'll be showing up at any minute. So if you're ready,
Yep,
he said to go
we'll-
ahead and get started.
We will get started.
Okay, so we're going to call this session of the joint work session of the Henry County Council, Henry County Commissioners to order. And Ms. Angela, you have the floor.
Okay. I sent the council and commissioners an email on the 7th because I was notified by the State Department of Health of our 2026 and 2027 HFI funding. So previously, in 23, our typical legacy amount, and that was from 2 small grants that came from IDOH somehow, some way. And that total was 58,132 and 84 cents. And it had been that for decades. And then the only other, that's what we ran the day-to-day operation of the health department on. Copies and, office stuff, things like that. And then we would have our settlement from our tax levy. And then we would have a small portion that came in through receipts from different things that we are allowed to charge for. And just to clarify about our receipts, where we make any kind of money whatsoever is in the environmental side of things with our food inspections, our septic, and other types of permitting that way, pools and what have you. The nursing side of the world has always functioned in a deficit, and we have relied on additional funding. For example, the yearly immunization grant that will come in, and that will help us provide and meet the state's requirements to be a vaccine for children provider. We do have a small amount that comes in through private insurance, but it's $10 a shot when the doctor's offices are getting $60 a shot. So it's really minimal. So it balances out that way, but we're very grateful that we are able to do what little business we can through the environmental office. So that piece is important. And then the HFI Senate Enrolled Act came into play. And for 2024, we were granted half of what our annual would be for 2025. So that amounted to $552,169.32. We were able to take that, and you were graciously able to keep us at our tax levy. The state said you had to in 2024, but you did. And so the settlement for 2024, which is the money that comes from the tax levy, was $491,242.89. Typically, that's very close to what we normally get. It's actually a little higher than the previous year for whatever reason. And then on top of that, and I did make one error when I emailed this to you because budget. I'm not sure that I added into that total we average $100,000 in receipts. So I think when I told you that all in, that gave us a budget with the cut 442,339. I think it should be 542,000 with my estimated receipts. So then this year in 2025, we were awarded the full amount for our county, and it was $1,067,157.04. Again, the council and the commissioners were gracious enough to continue providing us with the full tax levy settlement. We made no changes in fee amounts, so we still are running at that $100,000 in receipts, approximately. Every health department administrator looked these people in the eye and said, "Are you sure about this?" Because when they provided this funding, the thing that we kept saying to them is it is so difficult to write a budget 8 months before day one of the budget, not knowing what the taxes are going to be coming in. The council can only do so much, but you all don't have a crystal ball. Okay. So with a small budget like this, when I'm $10,000 or $20,000 short, that's a position or a half of a position. And we were running prior to the Health First Indiana budget with 7 full-time staff members. And I think I've explained to you that on a rubric that we were given by the National Association of City and County Officials, we should be having 30 for our health department. And so when the state asked us, what is it that you need from this? We said consistency. We need security. We need to know that it's going to be budgeted, that we can work with this funding, because you cannot go out and take care of people and save babies' lives for 6 months out of the year and then next month pull the rug out from under them. All right. So we were very skeptical about that. We were very worried. Then we were worried about hiring people, because you're pulling somebody from probably a private industry who has the servant heart and wants to work in public health, knowing that they're going to take a price cut to come work for us, pull them off of 10, 20 years somewhere, seniority, put them in here. And then if it doesn't come consistently, they're out of a job and they're starting all over again on the low end of the totem pole, lost their seniority. Okay, so we voiced those concerns. We were assured time and time again by the previous administration in the governor's office that we could count on this money. So this year, we let go. We hired some people. And we're all in this boat together, all health departments across Indiana. And the sad thing is, this year, there were many health departments who ended up only getting the 20% of their tax levy because the counties were already struggling. So now, you know, I don't know what they're doing, and it is a sad state of affairs. So with that said, this year, we were notified on the May the 7th that our HFI funding went from 1.67 million to $285,283.13. That was over $1 million we lost in the matter of an email. The statute still says that the counties are only required to pay 20% of that amount, which of the 285,000 come, if my math is right, $57,056.63. And so, Chad, does somebody have a calculator real quick? That way I can correct this. Okay. So our tax levy, if it's, remotely the same for, next year, is 491. Let's do 490,000 just for simple math. And then we're going to add the HFI, 285,283.13. 20% of that required by the Senate Enrolled Act is 57,056.63. It's from the beginning. 490,000. Plus the correct. Plus the 57,056.63.
Angela, doesn't the 57,000 come out of the 400?
Yes. Then I did not make an error. Okay, right. I don't think I did now. Thank you. Sorry about that. Right. So the HFI funding plus 20% plus 100,000 of our receipts, that total was 442,339.76. Now, if you compare that to what my tax levy was last year, that's 491,242. I lost money because I took it in the beginning. That's not how an investment works. Or if it's an investment, that's when you tell them to kick rocks, right? Okay. So my question to you all is, do I tell them to kick rocks or do we take the HFI?
You stated in your email, Angela, that if you did not have basically the tax, property tax funding, that there was no way you could meet the requirements of taking that money. If you do have the property tax money and we can accept the HFI money, do you think you can meet those requirements?
It's going to be tough, and they know it's going to be tough, so they better give us some leeway, but yes, I minimally can meet their requirements.
And not to throw more salt in this wound, but we still don't know for certain where that 491 is going to shake out.
Correct.
We're still waiting for Baker Tilly to compile the data and get that back to us. I mean, it should be close to that. I don't think it'll be half of that. And maybe it may be 95% of that, or it may be 105% of that. We don't know
Correct.
exactly at this point. But I would say give or take 5% probably is a reasonable estimate on that number for next year. Now, who knows what's going to happen in 27? Because Ken and I has
We-
looked into this even
One year at a
greater and
time.
said on that, yeah, we're going to take a much, much, much bigger hit come 27.
Correct.
When the personal property tax rolls out to $2 million exemption. So, but yeah, so I guess, the big question I had was, and I think Shannon already asked, and I don't know how we turn them down. I think we arm wrestle on the back end if they say, well, you didn't meet your qualifications. Well, we traded $1 million for 200,000. So it's kind of tough to do that. But I guess the other question I have is what ramifications are you going to have in your department to take that big of a drop? I mean, staffing wise, service wise, can you give us kind of I know I'm asking you to pull out your crystal ball now, but what's the impact? What's the estimated impact for 26 by having to take this massive reduction in that funding?
I think it'll be the equivalent of 3 FTEs.
So three people will lose their job. Is that what you're saying?
Or, yeah.
I'm sorry, I'm not
Or we
speaking
may
for
have, I
myself.
may have to, the equivalent
The equivalent
of those hours. So whether
Mhm.
that's part-time, full-time, or whatever.
Any of those paid by grants, or they all local funds?
Everything that, and one of the things that I did this in 25 is I moved all of our salary into the HFI funding. It was much cleaner, much easier to do that. And it was supposed to be consistent, so I wasn't worrying about having to cut anybody on that side. And then I put operating expenses into our tax levy. So everybody that is on staff right now, with the exception of our drug-free community coordinator and our STOP Act grant person, those 2 individuals are fully funded by a grant. Everybody else has FTEs assigned to them out of this money.
Or any of those individuals, say, for example, the JRAP, are they not qualifiable under the opioid funds? It seemed to me from reading the opioid that
They absolutely are. And one of the things that, one of the reasons that I asked to put the JCAP staff under this was because it was more money than we have ever seen. And it is such a positive product for our community. And it is addressing the #1 health issue that we have in Henry County. It made no sense. And there was no money from the county that was going to sustain that program, and the opioid money is finite. So it wasn't going to last. This was an opportunity for me to bring that program in and know that it was going to last.
is the opioid, I know there's some talk when it first came out that it may be suspect in the future. I know there's been cuts made at the federal level. Has there been any sign that that's not solid and safe? I mean, it's.
No, that is not federal money. Okay, let's be very clear. Opioid settlement fund was because we sued them, the pharmaceutical
The
company.
state of Indiana.
The state of Indiana sued them. That is a settlement. That's not the Fed's money.
So Okay, okay. Okay, very good.
Now, drug-free community grant that we have that Miranda oversees and Shay's working with that grant. We have been watching diligently to see if that money is going to be retracted. Right now, they have not pulled money back that's been appropriated from that. So there's nothing we can do but to continue on with the work until we're told otherwise. So it is definitely, there's a high probability that I'm going to need to come to the group and ask about continuing funding for, I have one full-time and two part-time people that run JRAP, hoping to get that money secured for 26 and 27 so we get through the current state budget. And the other position that worries me greatly that I have to protect at all cost is my Director of Health Promotion and Disease Prevention, which is Shay Becks. And that young lady manages over $1.5 million worth of grants for our office right now. I do not have the skill set to do it. Can I learn to do it? Sure. She's the skill set and she's doing it and she is knocking it out of the park. So if for whatever reason I can't keep that position, I will absolutely be coming asking for opioid money too, because it is directly related to that work, and try to get that position covered for the remainder of the state cycle.
Wrapping up what I've heard so far, it sounds to me like your main question or request is that we don't adjust down or really make an adjustment to your tax levy.
And that's correct. And I want to be clear, since I do have the commissioners here. And this was my understanding from a meeting with Baker Tilly before they were Baker Tilly, when Commissioner Kronk was in office. And we sat right here, and that was probably the first or second year that I sat here, and I was still trying to understand that pie. And Baker Tilly made it abundantly clear to the group that day that that tax levy, how it gets divvied up, is a commissioner function. They decide that, and there's a process for that. And we have surpassed the time frame in 2024 to allow that to happen and affect 2026 or
2025.
2025.
It would have to be done by May 31st.
And and
All
we're not
the-
going to
all the
make it.
Notifications, all the hearings, all of that stuff there's no way that could be. And Joel, you can correct me if I'm wrong. We've surpassed the time frame that could happen for 2026.
To make it for 2026, which is something, we can certainly look at in 26 for 27 at the beginning of the year. So I'll put a note to come talk to everyone about that. But yes. And I do understand that you can't guarantee me that the settlement will be 490, but I'm like you, Chad. I think in 26, 5% makes sense. And the way I typically do a budget, if I know that we're looking at 5%, I will budget 5% under. Just so, because it's always easier to put that money into part-time hours and increase, because I do have a lot of capable people that like part-time work. And that really helps keep our office running economically. So if I do the 5% under in the overall budget, I can add it back if it's there, no problem. So yes, Ken, and the question was for the commissioners, are you agreeable to me accepting the HFI funding and moving forward with that? And if so, if I could just get that on record as a vote, please.
So you were talking about whether or not you actually benefited from taking it, and I did not follow all of the numbers.
my concern was if the council were in a position, or the commissioners, if this body is in a position to look at me and say, Angela, I am so sorry, but we are only going to be able to fund you 20% of the HFI like it is stated in the Senate Enrolled Act, then I don't think that I can meet the state requirements with that amount of money.
So you were saying if we were going to reduce the tax levy, then it would not be, okay, I understand what you're
Or,
saying.
yes, reduce the amount
That's budgeted in your,
that's
in your
budgeted,
1159,
in the
1159
1159
line
health
fund.
fund, correct.
I believe maybe Debbie can respond. I don't think Angela budgeted 100% of what was being brought in 1159, maybe half. So there will be a small amount of reserve sitting there for next year. And
Correct. When I moved, when January 1 of 25, because there, that couple of years with COVID and everything, things were wonky. And in 24, I didn't bring over as much as I thought, but I'm back up to where I think it was 125,000 that I came into 25 with, which puts me at the recommended 6 months worth of salary in case something happens. So we've been able to do that for at least the last 3 to 4 years anyway. And we're very proud of that. That's important to us because we know how everything fluctuates. And if we didn't do that, you know, we have to have at least a couple of vehicles. If a vehicle goes down, I never had money before, you know, I had to trade marbles with Joe Wiley at one point to get the white truck that I got. And we drive it every little whip stitch.
So I just want to make sure I understand. You're expecting the settlement to be about 490
That's what it was in 2040.
and 20% match to get the state funds would be 57,000. And then you would get 285,000 from them.
Mhm.
Okay. And that's about 832,000. No.
no, the
was that?
57 is
Tell me.
part of
The
the
57 is
490.
part of the, yeah.
Okay. Okay.
So, but going the other way, Susan, if we accept HFI funding, you're correct, we'll be closer to 800,000. And to do that, then I have to agree to meet all of the deliverables of basically that grant money from them. I have to address infant mortality and prenatal smoking and all the things and stuff, you
Do
know.
you want to do those things? Is that worth it to you? Is that where you want to focus?
It is worth it. It is absolutely worth it. It's been worth it in the last year and a half. And the things that we've been doing all along that a lot of counties either haven't had the staff that's had the skill set, or they have had counties where everybody works, you know, in silos. We haven't had that. We have been very fortunate to be able to work, you know, together. I have had some funding that has been so incredible to be able to sponsor this or to do this. And it was just a little bit that the hospital needed to do something, or that, you know, Covering Kids and Families wanted to do something. And it's lots of times it's just $1,000 here or $1,000 there, but I never had that before to even help out with anything. We've got multiple media now that we can help get people's other nonprofits information out on. This money's paying for that. I'm paying, you know, the grant. We've got an IT, or what do you call it? What's the media lady? Talessa, you know, she was in our, contracted with her, and within 1 week, it was incredible. We were blasted, everybody. I mean, people know that there's a Henry County Health Department now, you know, and we're making our nonprofits stronger, which was the purpose of the health department all along. You know, we're that hub, we're the center, we have the pulse on everything. We have your ear, we have the hospital's ear, you know, we've got the state's ear. And as we learn about things, but you have to have people to do that. You have to have people that can sit down and meet the deliverables of the grants and write the grants, you know, and we've been able to do that. with the funding. So I'm hopeful that in 2 years, we'll be back closer to where we want to be. Wishful thinking, I have to, otherwise what's the use of coming out of bed? So we're rolling with it. So yes, I would like to give it a shot if you're comfortable. But again, that decision to take HFI rests on the commissioners, and I serve at your pleasure.
And so if we do so, we come out about $230,000 ahead. And
Yes.
you're obligated to meet the commitments, but it's the direction that you want the department to go in anyways. So you feel like it's a benefit to do.
I would.
Okay.
And you're also asking the council to work very diligently and hard to not reduce as much as we
As
can,
much as you can.
to not reduce the 1159 funding that
Right.
was prior to the HFI, to try to keep it around the amount that was prior to
Correct.
HFI. Okay.
Right.
Do we apply for this program every year? It's a yearly choice or no?
I believe so, yes. That's right, every year.
You mentioned earlier that you had 7 staff back in 2023, maybe 2022.
Mhm.
What do you have now? And I'm not talking about the.
11,
And some of that's through a grant, or is that all the local funding? And
no,
that
that's all that comes out of
here,
here.
okay.
So we only added 4 people.
Is this a joint work session or executive session? Okay, so you're just looking for some type of verbal, we're not going to take a vote tonight, but
No,
I'll
okay,
say that verbally that I support you doing
Correct.
that, but we're not taking a vote today.
that works.
I think what's disappointing is the
You good?
legislature seemed to go after the health first, the biggest chunk of anything. When they got the $2 billion forecast shortage over the next year or over the biennium, they seemed to go after the health first in a big way, more so than some other options that they had available, which I think is unfortunate. I think you're in a much better situation than when you took this position as a department. And I think you reiterated that last budget hearing, but I think because of your leadership and you're really watching the monies and where it's coming from, but I think you're doing a great job. I can't say the same for our state legislatures.
Thank you.
I think that there just wasn't time to implement the monies that were allocated. So there's no way to evaluate if it was effective or not because people didn't have time to ramp up and do those things. And so when the state says, well, the monies aren't being used appropriately,
Mhm.
maybe in 5 years they could have evaluated that, but it just wasn't an option really to evaluate it this year because it hadn't been in place long enough to.
It
use
hasn't
them.
been, you're right. And all of us that work in public health or medicine in general will reiterate that fact that we haven't even had a full budget year of the full funding. You know, it takes time to train people. It takes time to hire people. And, you know, the state knowing, the Department of Health, knowing that there would be this huge pull of resources and skilled people, they put into effect that if you were going to use HFI funding to hire someone, you had to post that not only internally in your county, but you had to post it on their website for 30 days. So there was already a 30-day lag before you could hire somebody. You know, and they did that so that we didn't pull, you know, so Allen County didn't end up with no nurses and, you know, we ended up with all the nurses and that sort of thing to do that. So, but I will end on this note. Thank you for that. And thank you, council, for, you know, I know you can't promise me this, but you know, in good faith, if you can, you know,
I support in good faith, working as diligently as we can to keep
Yeah.
you where you need to be.
I think we could all applaud the efforts that you and your department have accomplishments that you guys have done over these past few years. I mean, comparatively to where you were to where you are today, I mean, it's rock solid. I mean, you guys have done a phenomenal job and I can, again, only speak for myself in a work session, but I'm going to fully support, you know, trying to back what you guys need the best we can. Unfortunately, like Kenan said, the legislature has tied our hands with all this and So we are going to have definitely going to have some hurdles
I know.
overcome over these next few months. Budget
And-
session's going to be fun this year. Again, from the initials I'm getting, this year's impact 26's impact is not going to be as dire
It's
as
27.
27 could be, but hopefully we can work with the legislature and they can make some changes next year, and 27 won't be nearly as bad as what is anticipated. Because in talking to several of them, I don't think they completely understood what they voted for in the first place either. Some of them didn't even know that. I mean, I sent your email to our legislators and not a
Mhm.
single one of them responded.
Right, right.
And so, which kind of surprised me, to be honest. I thought they would at least respond. So,
One of the things that will not make a news release, but I will be happy to, well, actually, it's public knowledge. I think I sent it to you because they had to amend the HFI Act to state that and this is not why they said it happened, but I'm going to tell you why it happened. We cannot use any HFI funding to address tobacco, be it smoking or otherwise, with this money. The two exceptions are supporting a school corporation in their anti-tobacco efforts because we have to support the school nurse, and supporting pregnant women to try to get them to stop smoking at least while they're pregnant. Those are the only two things that we can support with HFI funding. So here's your lesson from Mrs. Cox from my 11 years of teaching. The first thing that I would tell my community health nursing students is this: the United States economy will tank and we will suffer a Great Depression for the second time should we ban tobacco products in the United States, because our economy is based on those dollars. The amount of money that the tobacco companies use every year to promote their products is in the billions of dollars, billions with a B. The amount of money that any local government or the federal government has to counteract that, low millions. So we know going into the fight, we will never, ever be able to outpace tobacco companies, and they are peddling death. Period, end of story. We've
And
known
the
that.
state's getting a lot of taxes off of it.
Uh-huh.
That's why they don't want that's why they don't want people to.
Right, because there was a lobbyist, I
Mhm.
guarantee you, had
Mhm.
enough pull at one of those committee hearings that said, if you're going to keep HFI period, and you're going to increase our tobacco tax by $2, you can't talk about this. So I will leave you with that thought process.
I made
Thank
the
you.
same statement to a few of the legislators that after the tax was passed, that if every smoker en masse quit, government would fail.
Absolutely. And then alcohol falls a close second to what runs our economy completely. So obviously Elon Musk is
I'll
not
get
aware of
off my
that fact.
soapbox, but they say they
So-
do, they say they raise the tax because they want people to be healthy and to quit smoking, but they don't.
No, not really.
Angela, thank you
Yes.
for taking the time.
Thank you for the
Thank you
special
for
meeting, your
those that
time. I
showed
know it's a
up.
middle of
Yeah.
the week. I surely appreciate it, everyone. Thank you.
Any other questions or comments on this topic?
I was just going to say that your initial comments that usually we get a full report and a 5-year estimation of revenues by Baker Tilly in early June. I think we're going to be lucky to get it by late June, because this legislative act is causing a ripple effect that they really don't know the outcome. And I don't think the legislators know the outcome and the impact that it's fully going to have. So I don't expect to get the kind of research that we've had in the past for 2 or 3 months, no, 2 or 3 weeks later, maybe just right before our budget hearings. It'll be very interesting and difficult.
Yeah, when I spoke with Jason at Baker Tilly, he's still thinking mid-June at best, but you're probably right. I mean, they're still working through the software programming and stuff, so it's going to be difficult to calculate everything because they keep digging in and they're finding more and more and more and more the deeper they dig. Anyone have any other further comments? Do I hear a motion to adjourn this special work session?
So moved.